Nevertheless, mental disorders do not often receive adequate research and attention. Today, we have a true pioneer in the world of psychotherapy with us, Mick Cooper. Mick Cooper is an internationally recognized author.
Different people benefit from different treatments at different points in time. Patients come to therapy with different ideas. It's important and helpful to listen to those ideas. Cognitive behavioral therapy that is really good if somebody's got a very specific phobia. What we've learned is the therapist needs to do something different. They can't just keep on bashing away at that.
Welcome to KhanKlinics, your dedicated space for exploring the vital connections that shape your well-being. Here we dive into everything from achieving peak physical fitness by mastering sustainable weight management to optimizing your diet for a vibrant life. We're passionate about uncovering the power interplay between your mental and physical health, offering you insightful strategies to nurture both. Join us as we unlock the secrets to embark on your self-confidence and your inspiration by interviewing the top-rated personalities, not from only the US, but around the world. At KhanKlinics, our commitment is to bring you evidence-based information that inspires you confidently control your health journey and live your life to the absolute fullness. I'm your host, Amir Khan. Let's get ready to unlock the true potential of being a human with the most amazing people around us. Mental health. Mental health is a significant factor for a sound and productive life. Nevertheless, mental disorders do not often receive adequate research and attention and are not addressed as a serious public health issue. Depression, which is affecting now 20 million of the population today, is a result of a unique combination of factors for each person's affected. They typically interact with genetic, environmental, social, and of course, developmental vulnerabilities. Mental health conditions have a profound effect on individuals, their families, and the society in general. Researchers should be encouraged to adopt a life course to understand depression and devise novel methods to optimize prevention, care, and recovery, using approaches that are accessible in diverse resource contexts. PDA, patients' decision aids, are important tools to empower patients and integrate their preferences and values in the decision-making process. So these techniques are saying that we must have some leaders and beacons to the path of mental wellness. We are going to unpack these sad realities and the efforts of the leaders who are working to deal with these storms. Welcome to another illuminating episode of KhanKlinics. I'm your host, Dr. Amir Khan. Today, we have a true pioneer in the world of psychotherapy with us, someone whose work has transformed how we understand therapeutic relationships, client agency, and the richness of human experience. Mick Cooper. Mick Cooper is an internationally recognized author, trainer, and consultant in the field of humanistic, existential, and pluralistic therapies. He's a chartered psychologist, professor of counseling psychology at the University of Roehampton. Mick has facilitated workshops and lectures around the world, including New Zealand, Lithuania, and of course in US, Florida. His books include Existential Therapies, 2017, Working at Relational Depth and Counseling Psychotherapy, 2018, and Integrating Counseling and Psychotherapy. Mick's principal area of research has been in shared decision-making, personalizing therapy, and counseling for young people in school. In 2014, he received the Karmi Harari Mid-Career Award from the American Psychological Association. He's currently a fellow at the British Association for Counseling and Psychotherapy and the Academy of Social Sciences. Mick, welcome to the show.
Thank you. It's very nice to be here.
Honor to have you, Mick. Why don't we start with one of the therapies that's catch our eyes a lot, and that's pluralistic therapy. Tell us, how is this different from other therapeutic approaches?
Well, a lot of the therapeutic approaches that people have heard of, like, say, psychodynamic therapy or person-centered therapy or cognitive behavioral therapy, have a particular model of why people are the way they are and how they can be helped. And certainly those models can be very, very helpful. But I think what we know often as therapists is that different people benefit from different treatments at different points in time. And therefore, we really develop pluralistic therapy as a way of trying to value and respect all the different ways that people can be helped, and to move away from an approach that started off from the therapist's belief systems or their ideologies about what was the right answer, and one that was much more client facing. Very central to our pluralistic approach was also the idea that patients come to therapy with different ideas about what might help them. And the research shows that it's important and helpful to listen to those ideas. I mean, certainly not that patients always know what is the right treatment, but they might know whether they find it useful getting advice or whether they want more space to be listened to. They might have ideas about what the problems are, what the causes of their problems. Often people have had experiences of psychotherapy before, and therefore have ideas about what they valued or didn't value. So in the pluralistic approach, we try and value both the different perspectives in the field and also the different voices, the patient voice as well as the therapist voice, the researcher voice as well as the theoretician voice, so that we can draw on really the best knowledge that we have without dogma, without biases, without assumptions, to really do the best thing for each of the clients that come to us.
Excellent, Mick. So tell us a little bit about what made you, or what inspired your team to develop this approach. Was it a specific moment, realization? How did it come about, and why was it needed?
So I came from, my original training was in existential therapy, and then I went on to work in an area called person-centered therapy. And these are therapeutic approaches that really emphasize listening to the patient, or we tend to use the word client, giving them space to talk, helping them find the answers within themselves to their problems. But I think what we realize is that actually, and we've found this subsequently, and the research is very true, is that not everybody comes to therapy wanting a lot of space to talk. There's often clients do want guidance, they want suggestions, they want to learn exercises, they want to maybe have assignments that they can do in between sessions that help them develop their understandings, challenge their thinking. So I think coming from this very client-centered, client-led starting point, we realized that that wasn't the answer for every client that was out there. And if we really wanted to listen well to clients, we had to realize that, kind of paradoxically, some clients wanted the therapist to have more of an input. And so the question becomes, Amir, how do you do that in a way that brings in the best knowledge of the client and the expertise of the therapist? How do you really work in a collaborative way together? And that's something that we're still really exploring, we're researching as a field, that we're trying to understand more. There's many, I mean, certainly in the States, many psychotherapists would call themselves integrative. And integrative is an approach that brings in different ways of working. It may be very much tailored to the client. Pluralistic, by definition, is very tailored to the client. But I think many other psychotherapists, psychologists in the integrative field are really trying to understand and ask this question of how can we work together in a way that is avoids being entirely kind of therapist, authoritarian, expert-led, but also doesn't just leave the space for the client to do the talking without much support or help or guidance. Yeah, so the pluralistic approach that we developed was really trying to find a way of really listening to the voices of clients and value and honor client patient perspectives, but also to bring in the expertise, the knowledge that is out there in the field to develop the best synergy really between the two people in the room and to find a way of working that is going to be the most suited to each individual patient.
Got that. So one of the key principles of this therapy is that different people are likely to be helped by different things at different times. What are the challenges make you guys as a therapist and see among the patients face when you're trying to apply the pluralistic approach?
Yeah, I mean, obviously, as a therapist, you specialize and you learn and train in particular approaches, and you can't offer everything. Different methods and different techniques take a long time to train in. So there's only a certain kind of scope that any of us have. And the first challenge is really to recognize and to be aware of what you can offer, and also importantly, what you can't offer. And actually, what it might be that if somebody comes to see you, that it's appropriate to refer somebody onwards and to suggest somebody else or a colleague of yours, for instance, that might be more helpful. There's some therapies, for instance, like a cognitive behavioral therapy that is really good if somebody's got a very specific phobia. So I know that if somebody comes to see me with a spider phobia, that actually, rather than trying to treat that myself, I'm better off suggesting that maybe that there's somebody else that they could work with who really specializes in that area. So I think it's about knowing the parameters and the boundaries of our practice. And recognizing that we are, that we all have limits and that we can discuss that with patients and people that come to see us, and that can be a really positive thing. The fact that we can't do everything doesn't mean that we're limited or that we're not good enough. It means that we're part of a open professional network in the same way that as a doctor, that you specialize in certain things. And if you were seeing somebody, say you're a pulmonary, a lung specialist, and somebody has problems with a kind of skin that you would refer somebody on, we also need to recognize our limitations. But often in the psychotherapy field, those boundaries are less well established. And it's partly because often people have very kind of generalized problems, depression. There's lots of different ways of working with depression. Anxiety, there's different approaches, but there are some kind of specific areas where there are approaches that are better than others. But I think often it's, like all professionals, as psychotherapists, we can have our own kind of interests, our own ego about wanting to feel that what we offer is the best thing. And so the challenge is partly to stand back from that and to really put our patients first.
Gotcha. But thank you for explaining that. The classic integrative psychotherapy includes theoretical, technical, common factors, and assimilative knowledge. When you come across a disagreement between therapist and a client, how do you go about then navigating your way about specifically the direction of therapy you want to go towards?
So there's been a lot of very good research in the psychotherapy field on what we call ruptures or alliance ruptures, when there's a breakdown in the relationship between the client and the psychotherapist. And we understand much more now through the work that's been done. A lot of this was in New York through an academic, a therapist, psychoanalyst, Jeremy Safran and his team, who we very sadly lost recently. What they found is that the most effective way as a psychotherapist, which sits very well with our pluralistic approach, is that if you're hitting a rupture, is rather than keeping on doing what you're doing and to put the kind of blame, in a sense, or to see the problem as being with the patient, the client, that actually as a psychotherapist, you need to stand back and you need to reflect on how you can form a bridge, maybe think about changing your way of working. Sometimes if a client is very upset about something, apologizing if that's the appropriate thing to do, and having a conversation at a more what you might call meta level about what's going on, as a way of thinking about why there's a problem and what the two of you might be able to do about it. So rather than, for instance, we have approaches like the psychodynamic approach that is a lot about interpretation. And then you might be trying to understand how the patient's behavior represents or reflects things that they did in their past, say with their parents. That if they're angry with you, that maybe that says something about their anger towards their parents, that we would use the word projection, that is maybe being projected onto you. And sometimes that can be very, very helpful, and clients can realize, oh, actually, my therapist hasn't done anything wrong, but I'm just carrying all this rage towards my father or my mother, and I tend to put it on other people out there in the world. But if what's happening is actually that the therapist is reflecting that back, and a client just isn't finding that helpful or feels that they're being blamed when they're angry, then what we've learned is the therapist needs to do something different. They can't just keep on bashing away at that and think that at some point it's going to be helpful. What often happens if as therapists we don't address those ruptures properly, then there's a risk that clients will drop out. I guess what that also means is that as a client, sometimes as a patient, sometimes your therapist will be challenging, and sometimes they will raise issues with you that may feel a little bit uncomfortable and may feel like it's taking you into new areas. And that is partly our job to do that. But it should be done in a way that you have an understanding of why it's been done. There's been some agreement beforehand about it. And also that if it doesn't feel good, that's something that you can raise and that can be talked about. That if you raise that, it shouldn't be that is always kind of brushed away and seen as a reflection of your problem rather than a legitimate concern.
Excellent. There's quite a lot of changes ongoing in the psychology field, and new terms and distinct concepts being introduced. And one of them is relational depth. Why is it important in therapy? What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of KhanKlinics.